Thanks, Catherine. Thanks, Kate. I would like to just call our panelists up. I think you've teed us up nicely for what the session is about. So I'm calling to the stage Professor Mary Coll-Seck, who is the chair of the Association of Galien Africa. She was also former senior minister to the president of Senegal, as well as the former minister of health. You guys can just come close up, come right next to me. We also have Dr. Neil Shah, who's the CEO of the Clinton Health Access Initiative, and Emily Bancroft, who's the CEO and president of VillageReach. Thank you guys so much for joining me. As Catherine has mentioned, this session is really about how NGOs can build deep and long-standing partnerships with governments. And when we talk about government partnerships, Chai's name really comes up quite a lot, Buddy. Can you tell us how you've managed to create these models and what makes them work?
Yeah, sure. Well, it's a pleasure to be here and to kickstart the afternoon. I will preface this by saying, Minister Awad, you'll keep me honest, both as a former Chai board member and Minister of Health where we've worked. So you can call me out if anything I'm saying is misleading. You know, I think a couple things that Chai really tries to do is first and foremost, we work at the invitation, the explicit invitation of either the head of state or the minister of health. So ensuring that there's the highest level buy-in for the government from everything for everything we do. Second is to strive as much as possible for the government's priorities to be our priorities and not actually have any kind of dual missions or dual mandates. And that's often hard because obviously any organization are going to have their own strategic objectives. Their donors are going to have their own set of strategic objectives, and the ministry is going to have its priorities. And those three circles are only partially overlapping. And so we try as much as possible to force the confluence of all three of those. And then a couple of tactical things. You know, I think we try very hard to do the small, unsexy work and the dirty work behind the scenes. So our teams are often physically embedded within the Ministry of Health, and we often help with everything from writing a speech to thinking about budgeting, all the way up to complex data analysis to inform important policy decisions. And we find that being demand-driven, responsive to very busy Ministry of Health colleagues' needs and essentially trying to serve in any way that's helpful helps to build that trust, and not just on executing the big parts of work that that are part of our explicit agenda. And then I think the last thing is to make a deep commitment to being in the country for the long term, right? This is not a fly-in, fly-out situation. Anywhere that we work, we strive essentially to say, are we willing to make a long-term commitment and being here to stay? And I think when the government sees that you're here to stay, it builds a different type of trust. So those are some of the core components that we strive for in building relationships with governments.
Thank you so much. Professor Awa, I want to come to you to check to see if Buddy's giving us the real here. But before I do that, Emily, are these some of the principles that you're also following? And can you take us through what works for you guys?
Absolutely. And I think I agree with so much of what Buddy has said, and it's very true. We talk about it as priorities and not projects. So how do you stay focused on, as you said, that intersection between your priorities as an organization? For us, that's building responsive primary healthcare systems that help to reach the hardest to reach communities. There's a lot of overlap there, right, between, that mission that we have and what the priorities are within the government of which are those priority populations that they want to reach, what are the ways that they want to reach them, and how can we assist them. And trying to stay away from being what I would call a project-based organization, which is where your staffing, your resources, even where you work ends up getting defined by a project as opposed to that focus on priorities. So for us, that's been choosing 3 countries that we work in very deeply over a long period of time: Mozambique, Malawi, the Democratic Republic of Congo, and making that long-term commitment to really working side by side with those governments to show what a responsive primary healthcare system can look like. But a couple other principles that I think you sort of touched on, but that are really important to building that trust. One is around transparency. And I think especially transparency when it comes to cost and to the work that we do. And that is something that NGOs are horrible at. It's something that most are not comfortable with for a lot of probably good reasons around fear of, maybe what the government will think or what other partners will think, or just a lack of dialogue and sort of transparent conversation about costs or what it takes to do work. And so I think there is a piece that we all have to hold ourselves more accountable to, which is, what does it really take to build those transparent relationships, and how are we willing to be more open about what it takes to actually do a piece of work or scale it, so that we can work collaboratively with government to bring things to scale.
Professor Awa, it all sounds good, but from a government perspective, is this what you're looking for? And what makes a good NGO partner?
Thank you. And I am lucky, having been minister, but also sharing some NGOs. So I cannot be in this side on the other side. But I can tell you that I have 3 points. The first one is trust, and you discussed this already. Often you need to ensure that you respect each other. When an NGO come in a country, the NGO need not to come and say, oh, these government, they are useless, they are not doing their job, they are corrupt, they are da. They need to first learn and see by themselves what is the issue and how they can help. The trust also is from the side of the government, who is looking always to NGO like, they are coming to look at our things, they will go elsewhere, say that, etc., etc. Donc, trust is very important. It is a base of this collaboration. Alignment also. You cannot be an NGO, and we have seen it, coming to a country doing their own things, and the ministry is not aware. And sometimes you have the information, or you come to a meeting like this, and NGO from your country give data, give results, and everything from your country, and you are not aware. Well, I think that the alignment first to the priority of the countries and the ministry is very important, but also transparency, really respect, I think, to each other. The final point for me is, as principle, is added value. An NGO is not going in a country to lose. They come to support, to ensure that the outcome on health will be better and things like that. But don't come just to have a grant, and you come, you do your thing, you prefer not to speak to anybody, etc. This is happening in our countries. And I think that basically this issue is more an issue of respect.
Trust and respect. I hope I don't start breaking trust and opening old wounds with my next question, because it's easier said than done. If it was as easy as we're saying it, I think lots of people would be doing it. Lots of people will be doing it right. But what are some of the challenges that you've encountered? First of all, from an NGO perspective, you're trying to make this engagement with governments. You have the best intentions, but what are the challenges?
Yeah, I think the challenges are real, and it's important to call them out. I alluded to it earlier, but this mismatch in priorities and incentives of the NGO's own strategic priorities, the donors' priorities, and the ministry's priorities is a structural reality of a lot of the work that can lead to a whole set of challenges. And so the question is, how do you mitigate those? I don't think there are any silver bullets to doing so, but I do think forcing the conversation as early as possible when you're coming into a country, when you're designing programs, when you're having conversations with the donor, to keep pushing and naming explicitly what are the potential places of mismatch between the government's priorities and other priorities. And hopefully through that explicit acknowledgement, discussion, and debate of that, you're able to get more and more coherence between all of those competing objectives. That's one. I think the second practical reality is just the business model that many NGOs function under, where you have lean budgets intended to deliver against specific targets. And that often doesn't create the space for you to do the type of flexible, responsive work that I alluded to earlier as a core part of building trust, being able to just show up to the ministry and say, what are your priorities? How can I best support you? And sometimes that has nothing to do with your grant deliverables. That's setting up a technical working group with all the other NGOs so that the ministry actually has a chance to bring together disparate partners with disparate priorities. Or it can be, any host of smaller tasks. And there's a fundamental business model challenge that I think NGOs can try to get creative about. How do you build in flexibility so that you're able to be maximally responsive to emergent government needs, in addition to delivering on the things that you have some contractual obligation to? And I think the last I'd just say is, ultimately, a lot of it comes down to the internal organizational culture and values. Are you operating with trust and respect? Are you operating with both humility and a sense of urgency? And that those softer features, I think, are critical to being able to weather the challenges that are inevitably going to come.
Okay. And Emily, what challenges have you experienced in your work? Is it the same?
Yeah, so I'm glad you brought up the donor dynamic, because I think that's a missing piece on this panel, in that the dynamics between governments and NGOs, I don't think you can separate the donor dynamics from that when you think about what causes, some of the challenges that you're talking about, Buddy, and some of the challenges that you mentioned as well, Professor Coll-Seck, around, having organizations that are talking about work that you aren't even aware of in your country. And I think for too long, there are donors that have used NGOs as their proxy to government, which means then that their priorities are being, or the translation of government priorities are coming through some sort of intermediary. And so I think it is a big challenge. And the way to address that challenge is for more donors to be talking directly to governments and not counting on just NGOs to be that proxy. And I have a good example of where that's happened for us, and it creates a new set of challenges, but I think it also creates a lot of opportunity. So there's one donor that we work with, a private foundation donor, so not a bilateral or multilateral. Bilaterals and multilaterals tend to have more of those channels directly to government. But in this case, a private donor. And, they went to the Minister of Health and said, here are 5 things that we could help you with. And the minister said, okay, there are 3 on that list that are actually important to us, and we would welcome your support and partner, some partner support in that area. So then this donor said, okay, well, here are some partners that we've worked with before that might be a good fit for this. And the minister said, okay, we know that partner, we've worked with them before. It happened to be us in this case, but it could have been somebody else. So yeah, that sounds good. But it didn't stop there. The donor asked us to put together a proposal, but that proposal went first to the minister and his team. And it was the minister who reviewed the proposal and who gave feedback, and his team gave feedback on it first. And then it came back to us and to the donor. And so by setting up that dynamic, yes, there are challenges, right? That may come up in that process. As the NGO, you may not end up doing, or the technical partner, you may not end up doing what you thought you were going to be doing. It may change things, but the real benefit was that there was already then this expectation that the donor, the partner, and the government are all talking together about what needs to happen. And so when other barriers come up, like timelines, we work on very different timelines sometimes than maybe what a government is able to drive forward in terms of change within their structures. But when those challenges come up, there's already a communication, there's already sort of an expectation that the 3 of you are going to work on those challenges together. And so I think, yes, those challenges exist, but if we can sort of bring donors to the table in a different way, we have the ability to potentially help to overcome some of those challenges.
Thank you. That really sounds like more communication, more cohesion, and actually reminds me of a story that we reported on. Our senior global health reporter, Sarah Jerving, reported on an issue with the MasterCard Foundation's COVID-19 vaccination program. And that involved a lot of health workers in Nigeria not getting paid. And one of the key takeaways from the health minister of Nigeria, Dr. Pate, was NGOs need to work within government systems and really bring the government in, because it was a reporting issue mainly, but it was just a lot of miscommunication and misunderstanding between smaller NGOs, the MasterCard Foundation, as well as other implementers in the program. Have you seen examples of that, Professor Awa, and how do you overcome these challenges?
I think that we have to look at concrete platform of coordination. Because when the ministry itself is not strong enough to be able to call people, to discuss with them, to involve them in the decision-making process, on the monitoring and evaluation, on all the, I can say, the very important steps you have in the ministry. At the end of the day, if people are doing what they want, it's the force also of the ministry and the ministry in general. And this issue of coordination and alignment around real priorities and plan can help to overcome all these type of things. But also, one of the obstacles, because you are asking for obstacle, is the fact that often NGOs can come with a lot of money the government didn't have or the ministry didn't have. And one of the main, for me, difficulties is to ensure that you are not looking at the priorities of the NGOs because they are coming with money and with their own priorities.
It's tempting, isn't it?
It happened. It happened. Some countries, some ministry maybe just look at the financial support, but not at what is real important for your population. Another point is, to be sure that we don't have a sort of duplication or rivalry between NGOs, big NGOs from the north and the NGOs from the south, and the community-based organization. This is an issue. I think that globally your team is not looking a lot to that. It's more the big NGO coming in a country, but they can also, if we are not careful, kill all the initiatives of local NGOs. And this is an obstacle, and this is a challenge we need to ensure that when the big NGOs are coming also in countries, they will capacitate smaller NGOs and maybe the communities to ensure that when they will go, because they are not staying in the country all their life. Donc after when they go, people will be able to continue the work. Donc this link seems to me also very important.
Thank you so much. I want you both to comment on that final one. But before we do that, I want to turn to an audience question. We have Vicky Reed here with us, who's the Interim Executive Director at Partners in Health in Sierra Leone. Vicky, I know you have a question and maybe some comments for our panel.
Sure.
If you just speak, it'll light up at some point.
Thank you very much. So my question really is for all of the audience members, maybe also particularly for Professor Awa. I think a lot of the theme around the sessions that I've attended today have centered around partnerships, not just with NGOs, INGOs, but particularly with the governments of the countries that we're implementing. Professor Awa mentioned a little bit a while ago about, transparency as well as, for example, the budget. I think for me, for Neil and Emily, around the budget, how transparent do we need to be around budget, especially when sometimes, like Professor Awa mentioned, you may see the NGO coming in with a lot of money, but then those priorities and what the government priorities are, there's maybe not so much alignment with that. How transparent do we need to be? Because that also builds trust with the government as well, to make sure we have that sort of beneficial relationship.
Thank you. I think we'll start with Professor Awa.
I would like to put the question to them. Because I think that we have a sort of rumor every time in countries where people tell you that all these NGOs, they are coming to the countries, but half of the money is for them. For their own salaries, for their own things, and they are going and coming, they are traveling, etc. And at the end of the day, what is useful for the country is really not peanut, but a little bit. Mm-hmm. I want you to, because I don't think that it is completely true. And it is why I would like you, in your response also, to try to show that you are not going in the countries just to do what you want to do, but you go to help, and your objective is better outcome for our population. This is very important because I think this issue of trust and all these things is also part of how the money is used.
Yeah.
Emily, you can start. Want you to open up those books for us. How much actually goes to programs? How much goes to operations? Are the rumors correct?
Well, I mean, to be fair, yes, we have staff and we pay staff, right? And so I don't think, I think about it sometimes as we are also part of the local economy. So our staff are all citizens, residents of the countries in which we work. And so I do think, there is that, but yet we know, because you see it on paper all the time, you see the difference between what a government employee is making and what an NGO employee is making, right? And it's real. It's very, very real. I think what's so important is for us to, if we are expecting the government to be able to, so our role, let me start with our role. We see ourselves as de-risking innovation. So helping governments decide what's worth investing in and not. We are trying to push primary healthcare towards the hard to reach communities, which means it's not necessarily just supporting the status quo, because we know, all of us, governments included, that the status quo today means there are people that are left out of the system. And so part of our job is trying to figure out what are those cost-effective ways to move healthcare closer to the people that need it most, and to bring in those voices and understand what those needs are. So there is a piece of this that is about innovation. There's a piece about de-risking, and trying to help governments determine what's worthwhile to scale up and to spend money on. But we can't do that if we're not honest about what that costs. And the conversation that we've been having internally is, we love in the NGO sector to talk about cost effectiveness. And that's great, and it's super important, and donors love it, and it's the language that's used. But there's another piece, which is it affordable for governments? And some would even use the terminology, is it cheap enough? I don't love that terminology, but I think it's an important question. Does it work within the resources that are available to the health system? Now, we want to be increasing those resources, but we also need to recognize where those resources, what the limits are of those resources. And so if we're not willing to talk about what we're spending to, let's say, help the government test and scale up a telehealth and telemedicine platform, if we're not willing to have honest conversations about the skill set that it takes to do that, the cost of that skill set, the cost of operating it, the partners that you need to bring in, well, then we can't expect the government to carry that work forward. So I think that we need to push our teams to have those tough conversations about cost, while acknowledging and recognizing that there are these completely unjust dynamics around, the payroll of a government employee and the payroll of an NGO employee. And I don't think we can pretend that those don't exist today.
Thank you. And Buddy, is this, in addition to the question that Professor asked, is this actually happening? Are those frank conversations happening?
I think it depends on how you define the conversation. In my experience, something that we try to do is ground everything ultimately in what are the impact objectives of a particular body of work, and how much does it cost to achieve those, right? So if you think about budget transparency from the point of view that you open up your books and every single line item under the books, I'd say that happens occasionally, but that's not the standard, of course. What I find to be more helpful and often more valued by our ministry colleagues is to say, what is this body of work going to accomplish for me, the Ministry of Health? And how much does it cost? And does that feel like good value for money? And is there added value in working with the government on that? So for instance, if we're helping to build a new data surveillance system for a national malaria control program that is going to allow them to figure out at a subnational level where are the hotspots in malaria and where they should target their limited national malaria control program resources, I think what we say is we believe that we can set up this whole system that's going to now allow you to do geographic targeting and improve your overall cost effectiveness or lives saved by this amount. That full body of work is going to cost this much, and let's go together to the donors to pitch that. And so I think at least that level of transparency around what is to be accomplished and how much does it cost to accomplish it is the first step. I think there is a second step, which is like even greater line item budget transparency. But I see, frankly, a lot less of that.
Professor Awa, we talk about two steps here. The first step is sort of defining what it's going to cost and what the benefits are. And then next step would be like those budget items. What's good enough? Like what would, as a government official, a former government official, what would you want to see? Is it good enough to just have that overall figure and the overall benefit, or are governments more interested in like full transparency where you actually see these line items?
Transparency is very important, but result also. Government would like to see results. Government would like to see if an NGO is coming to support you to decrease maternal mortality. When they are doing this work in the field, what you want to see, for me, is how they are doing it, how they are communicating, how they are sending you the data and things like that, and what is the results for the population. Do sometimes themselves are so happy that they go everywhere to the radio and everywhere to say, wow, we have seen change since we have these people working with us. This is what we want. In fact, the transparency is not only money, it's for everything, and to ensure that the result is the result of the work we have done together. Because this need also, when we say partnership, is not just let you go. When you go somewhere, you will have the civil servants there, the health workers, the community health workers, and all are depending of the ministry. Donc this is a teamwork. Transparency, fine, but at all level, for everything, but it is not just to look at the money, where is the money? At the end of the day, you lose also a lot of time on that, and you don't have the result you are expecting to.
Okay, thank you. And you had posed another question, which I want to come back to Buddy and Emily on, and that's around localization. We've been speaking about international NGOs and their interactions with governments, but how do we bring in local partners and ensure that that whole ecosystem is sustainable? Buddy, I'll start with you.
Yeah, this is a complex and critical topic. I'd offer a couple of thoughts. I think the first is that there's a huge amount of nuance, and I think we need to bring that nuance to the floor, and that operates at multiple levels. I'm an American national who lives in the US. My parents are from Tanzania and India, and I've spent many years living in different parts of the world where we have operations. Second is that different international organizations are structured differently. Right? If oftentimes a donor asks a Ministry of Health official, which is your preferred local partner, oftentimes their answer will be, the CHI team. In part because there's not a strict dichotomy between international NGOs and domestic organizations, and I think that nuance is valuable to bring out. And then the third is that any vibrant ecosystem has to have, I think, a diversity of perspectives, expertise, and experience. And so if I think about, say, our work in Nigeria, where we partner extensively with both patient communities, community-based organizations, and the CHI team that takes advantage of the expertise from other country offices, both on the continent and in India and Asia, there's a tremendous amount of value, I think, and if you ask Minister Pate or others in the government, that they get from that full constellation of ecosystem partners, from the most grassroots and patient-centered organizations to organizations that are able to pull lessons from different country experiences. And so I think ultimately, everything should come back to what is the government's priority? What does it take to actually execute successfully on those priorities? And then how do we organize that ecosystem of actors, each of which is likely to bring their own expertise and experience and perspective to solving the priorities that the government has?
And Emily?
Yeah, I often say that although VillageReach was born in Mozambique, we recognize that we were raised in both Mozambique and other parts of Africa and the United States. And you can't, as Buddy's saying, you can't separate. I mean, there are benefits that we have to that identity in terms of some of the relationships that we've developed, some of the partnerships that we have, and there are also drawbacks to that identity, and we shouldn't pretend to be something that we're not. The way that we talk about our work today is the importance of being locally driven but globally connected, and I think what you say resonates, Buddy. I think we need in country for the governments and the partners that we work with to see, our team as driven by local priorities and, connected to the local community. At the same time, we recognize that there is value in being able to look across countries and to be able to look and draw those sort of connect points and to bring those voices together. And so I think our role is to make sure that we are partnering authentically, not just with governments, but also with the organizations at the country level who really can bring forward the voices and perspectives of communities that we may not be able to bring forward where we're structured. So I think that ecosystem that Buddy talks about is really, really critical. And then making sure that we're holding ourselves accountable and the communities are holding us accountable to being an authentic partner to them in the same way that I would ask governments to hold us accountable to being an authentic partner to them as well.
Thank you so much. Professor Awa, I'm going to ask you to close the session for us. You previously stated that you can talk on behalf of NGOs and you can talk on behalf of governments. So if you're to give people some key takeaways to go back with, some practical steps to go back with, what would you want them to leave this session with?
I want to just summarize a little bit, and I am first very happy to see that all the NGOs we are working with, particularly in my own countries, are really taking into account to ensure that the trust exists, that we have all aligned, and the ministries themselves has to see what is the added value of having all these partners around the table. And it is not only the NGOs, it's also the donors, it's also the private sector, everybody. I want to add something we have not said, which is that we cannot just look at NGO from the health sector, because we know that what has been a big problem for all the sustainability of the result we have is that we are working in silos, and we need to know that the NGOs working on sanitation, water and sanitation, as important for us. Those who are working on nutrition or agriculture. Now, it is important to know that and push the agenda that health is not medicine or patients, it's also all the determinant of health. The transparency also was one point we raised, and I think also that it is very important to have NGOs who are really transparent in what they are doing, not only for the financial issue, but for everything. And particularly something is the data. How they use the data. And first step is to do that in the country. Before going elsewhere to do big reports on the data of this country or another, it is important that the country has the information and be able to change sometimes policies or the strategies they are using, because data are important for decision-making processes. Finally, I would like to say that the collaboration with NGOs from the south and NGOs from the north is very important, and we need to ensure that when the NGOs from the north will go, because they have other things maybe or other priorities, that the NGOs from the south are sufficiently capacitated to be able to sustain the results and support the government on that. And this is for me the thing I would like people to take, but we need to know that we are all friends. We all want things to happen. We all want our population to have well-being. Let's work together, being open, being transparent, and trusting each other.
Thank you so much. That's the perfect way to end this session. And thank you to all my panelists for joining me. We'll move on to the next session and I'll hand over to my colleague.